Hi, everyone. This is Tracy with the Oasis for Natural Healing. We are just a little bit late. Sorry about that. Had some technical issues, and we're going to get started. So tonight, we're going to be talking about some pain management and chronic pain. I have somebody from Platinum Chiropractic that's going to be joining us and talking about chiropractic care as well, and how that can help alleviate pain and actually improve mobility, improve flexibility, and actually as a pain maintenance and pain management as well. So we're going to be talking about a couple different things. So if anybody is new, hasn't seen me before, I am a nurse practitioner. I have been doing holistic health now for about 6 years. I've been in the Western medicine field since 2001. I got certified in this because of some of my own health issues and found out that there are a lot of things that Western medicine is great and it helps, in acute issues. But as far as long-term health goals, we want to get to the root cause of it, because otherwise we're just masking the symptoms. And the same thing actually goes with pain. So you want to get to the root cause of why you have pain. And there's actually a lot of different issues. So I am going to start talking about pain management and how we can actually help alleviate that for you guys. So, all right. Okay, so pain in the what? Now, a lot of you guys might have pain issues. And I would like to talk to you about acute versus chronic pain. So acute pain occurs suddenly. It can be associated with something specific, such as surgery, injury, a procedure. Life usually returns to normal after appropriate healing time and no more pain is experienced. However, there's a lot of people that wind up with chronic pain, and actually chronic pain can be a result from an acute pain or an acute injury. So chronic pain is what we're mostly going to be talking about for a lot of you people. It can last 6 months or more, and it can occur after an injury after an illness has technically healed, and it can occur without a specific cause. But we'll kind of go into that because there usually are specific causes for that. So a lot of people are afflicted with arthritis. So there's two main types of arthritis, and you can actually have a mix of both, osteoarthritis and rheumatoid arthritis. So osteoarthritis is the most common form, and this affects millions worldwide. It's actually a result of joint deterioration. The pain can be debilitating in later stages and leads to a lot of pain medication usage. A lot of people are on opioids, Norco, Vicodin, Oxycontin, oxycodone. These actually can be very addicting, which causes dependency. So you're dependent upon it. Lots of major bowel issues too. I've seen a lot of older patients being in as a cardiac nurse. They would actually have bowel obstructions. They'd be constipated. And by the way, you should be at least having a bowel movement once a day. And if you're not, your bowels are sluggish, and that can actually be an indication of poor health. There's also, you can develop a tolerance, which means that you actually need more pain medicine to do the job that it did before. So like, you're on this pain medicine and you take 1 tablet a day, and all of a sudden you actually need 2 tablets now to do the same job and to get the same relief that you did before. That's tolerance, okay? So you require more pain medicine than you previously did, and it's the same type of pain. Nothing has necessarily gotten worse. You just need more pain medicine to do the same job, okay? People with osteoarthritis may require surgery as joint mobility decreases. So you can wind up with arthroscopic, which is usually non-invasive. It's very minimally invasive, I should say, or you might wind up with a joint replacement, okay? So I kind of wanted to this is a joint, picture of a joint. So one of the things that, so with osteoarthritis, so these are two different bones. This is your whole joint right here. Okay. So this is two different bones that come and meet together, and that creates part of the joint. Okay. In simplest terms. So a lot of times this part will actually break down. This is your cartilage, and then this part of the bone, once this part of the cartilage breaks down, the bones actually rub together, and that's what causes a lot of the pain. Okay, because you don't have that cushion. This white area is your cartilage, and this actually creates a lot of cushion. It protects the joint. You have the synovial cavity, which is produces fluid, and that's kind of your lubrication. Okay. And so this is a little bit, and I'll explain, I'll go back to this a little bit later. So the difference between osteoarthritis and rheumatoid arthritis is, one of the things is rheumatoid arthritis, the synovial cavity actually becomes very inflamed. So this becomes, the bursa becomes inflamed, this the synovial cavity becomes inflamed, and it actually puts pressure on the joint. You can get a lot of swelling, and it's basically the body is attacking its own self. Where in osteoarthritis, you have a breakdown usually of the cartilage, and then you have the bones wind up rubbing against each other, and that causes wear and tear on the joint itself. Okay. So again, rheumatoid arthritis, as I previously showed, that is where the synovial cavity and lining becomes inflamed, leads to swelling and pain. It's an autoimmune disease where the body actually winds up attacking itself and attacks the joints and the surrounding tissues. And with rheumatoid arthritis, it is not limited to just joints. Okay. This can actually wind up causing lung issues. People can wind up having breathing problems. You can have skin eruptions and skin irritations, and it actually can affect the eyes, where you can actually start losing your eyesight as well. So this rheumatoid arthritis usually affects multiple joints, but it also affects organs. So it's a multifaceted type of disease. This is chronic. And extreme fatigue is actually the hallmark sign, and you might not have any other symptoms other than extreme fatigue in the very beginning. So how rheumatoid arthritis is treated, and you really can't do much surgery with this, because again, it's an autoimmune disease. I mean, you could for joint replacements and stuff like that, but really medications, NSAIDs. NSAIDs are your ibuprofen, your Aleve, Excedrin, Advil. Those are what's called NSAIDs. That's a group of medications. With chronic use of NSAIDs, you can actually wind up with stomach ulcers, where you actually wind up with holes in the lining of your stomach. You can wind up with gastrointestinal bleeding. That's where you actually, so these ulcers, these holes, can actually cause bleeding, and you can actually have bleeding in your stomach or your intestines. Okay. Then if that doesn't work, then you have DMARDs. DMARDs are a type of group of medications that actually suppresses the immune system, because again, in Western medicine, we think that, rheumatoid arthritis is an autoimmune disease. And so we have to suppress the immune system. Okay. So people who take DMARDs, these are autoimmune suppressants, and a lot of other diseases such as psoriasis is also on these type of medications too. And you wind up with getting sick a lot. You have a chance of getting cancer, lymphoma, chance of TB. So these are very serious medications where it actually suppresses and cuts your immune system off, and it can actually wind up to life-threatening diseases taking these medications. So that's one of the things that, is the downfall of and taking some of these meds. And I understand, because these are chronic pain, and these are very painful diseases to actually have. So a lot of people look for any type of relief that they can get. Um, one of the other things that I would like to talk about is fibromyalgia. In Western medicine, there is no known cause technically for fibromyalgia. It's believed to be the way the brain perceives pain signals and sensations. Okay. Possibly a result of a specific event, such as surgery, trauma, and infection. There are multiple symptoms of fibromyalgia: widespread musculoskeletal pain, fatigue, headaches, memory and mood changes. So treatment includes pain medications. Again, there's a lot of steroids. You can wind up using like Lyrica, things like that for fibromyalgia. Again, Norco, a lot of opioids are used as well. Counseling, because a lot of fibromyalgia patients have a lot of anxiety. They have a lot of depression around this because it is so debilitating. And again, and I'm going to get into actually mood a little bit too about people with chronic pain. So there's different, they encourage counseling. So a lot of people with fibromyalgia actually seek therapy, or will go to a counselor or a psychologist. Physical therapy is also recommended as well for people with fibromyalgia, because stretching and movement sometimes does help with that. So those are some treatments, at least in the Western medicine world, and we're going to get more into alternative treatments and a comparison. So there are real solutions to these issues, though. Okay, if there's a cause, there's a solution. And one of my favorite topics to talk about is parasites. I love talking about parasites. I think I've mentioned this before in some of my other videos. It's one of my favorite topics. I really like talking about parasites. So parasites leads to polyarthritis. Okay, and I put actually a number 1 and a number 2. You'll see that on the screen. So right here, there's actually research journal articles, so that you can actually look, if you wish, that actually linked polyarthritis to these type of parasites. So polyarthritis is where arthritis actually hits multiple joints. Okay, so I'm not even going to attempt to pronounce these, but these are 2 parasites that have actually been known to cause arthritis and multiple arthritis in multiple joints. And there was actually more research and journal articles than what I looked at that actually state this. So parasites actually can embed into joint capsules and cause arthritis. But guess what? You get rid of the parasites, the pain significantly goes away. So that's the beautiful thing about this. So, and then there's rat lungworm. Okay. Now, this is a neat little parasite. It's actually a lot of people who eat snails or escargot, and or even if you don't eat that and you have like vegetables or fruits or anything else that may have had like slugs or that kind of stuff on there, and that weren't properly washed, you can actually get this parasite in your system from eating non-properly washed vegetables and things like that. Rat lungworm actually causes tingling and painful sensations on the skin. And from what it sounds like, from what people have described who have actually been diagnosed with rat lungworm, it sounds very similar to fibromyalgia. Now, there's no actual proof that rat lungworm can cause fibromyalgia, but the tingling and painful sensations throughout the whole entire body and on the skin, just in random places, just sounds a little familiar to fibromyalgia. So there might be a link without actually knowing about it, but that's kind of actually one of my little own theories for part of fibromyalgia, but that's just hearsay right now. But I just wanted to bring it up because of the similarities between the sensations of Brett lungworm and people with fibromyalgia. Now, one of the other things that I wanted to bring up was leaky gut. So fungal overgrowth, believe it or not, so people with a lot of fungus in their body, and what happens is if you have leaky gut, so I talked about this last time, so I'm going to just kind of quickly go over it. You can watch the other video that I did 2 weeks ago about leaky gut, and I talked about gut disease. So basically the lining of the gut, so you have like tight junctures, right, and within the gut, and it kind of keeps everything in. And when poor diet or from overuse of antibiotics or from hormones such as birth control, that can actually change the pH balance, weaken the gut, and you can wind up getting leakage of fungus, viruses, bad bacteria. Everything that's supposed to stay in the gut no longer stays in the gut, including food particles that were not properly digested, okay? So this fungus, because we all have a little bit of fungus in our gut, it causes an issue when our pH is off, and then fungus can actually overgrow and we can have a candidal overgrowth in our system. Well, this fungus can actually leak into the bloodstream and actually travel and actually embed itself into joint tissue. Food intolerances actually also can cause a whole bunch of inflammation within joints. You might not be allergic as you think you are, like you don't wind up with rashes and things like that, or people who have wheat intolerances and stuff like that, but you can have at least some intolerances where it might cause inflammation in their joints. And I've had a lot of patients that have switched and gone grain-free and do a paleo diet, and after several months of just changing their diet, their pain decreases significantly. So I really recommend a lot of my patients to do a paleo diet, which means getting rid of your breads that are made out of wheat, switching to breads that are made out of coconut flour, almond flour. Instead of having your corn chips, there's actually a really good brand. I like it a lot because I'm a chip head. Okay, I love chips and guacamole. I love chips and guacamole. So there's a really good brand called Late July. I like it a lot. It's made out of tiger nut. Now, tiger nut is not a nut. It is an actual root. It's a vegetable root. So tiger nut, it's made out of tiger nut flour. And it actually is a pretty good chip. It almost tastes exactly like a regular tortilla chip taste. So to me, it's a win-win. So for those of you who are chip heads, that might be a good alternative. Anyway, so changing your diet is really actually key as well. Toxins, heavy metals, chemicals, these can cause, so mercury, I think I talked about this in a previous video as well. Mercury actually has an affinity to fatty tissue, but it also has an affinity to joints and bones and cartilage and things like that. So a lot of people can wind up with joint inflammation or heavy metal built up in their body that you have not been able to get rid of or detox properly. And again, that was talked about in a previous video. So I encourage you to go back to some of my other videos. I think that was in What the Health video. So if you want more information about the toxins, go look at that video. It was a pretty good video, and I talked a lot about toxins and where they come from. Okay. Metals and chemicals, they can lead to imbalances of minerals and vitamins, which actually also may be the cause of fibromyalgia, is a vitamin and mineral deficiency, which we know that vitamin B is very important for nerves and the nervous system to function properly. So a lot of people can wind up with like all these different types of pains and aches. Muscle pain can be from vitamin D deficiency. So there's a lot of vitamins and mineral deficiencies. And remember, you might have a normal lab level. Just because your labs are normal doesn't mean that it's normal for your body. You have to understand that when we draw blood on you, we're comparing your blood to millions of other people's. It's an average. What's normal for you might not be normal for somebody else, and vice versa. So it might be in the normal range, but maybe it's too low for you, or maybe it's too high for you, no matter what level you're talking about. Okay. So, or what lab you're talking about, it might not be the right level for your body. Okay. So, one of the things that I want to mention is, so you see the word sugar up here. So imagine that you also have chronic pain, right? So chronic pain can actually cause organ dysfunction, or organ dysfunction can actually cause chronic pain, and can also lead to nutritional deficiency too. And the reason why I'm saying that is because, so you have chronic pain, you have inflammation within the body that can cause inflammation throughout your whole entire body. It can lead to mental illness. Okay, so remember, your brain is an organ. Organ dysfunction, such as problems with the spleen. So your spleen is, by the way, the biggest lymph node. So in my practice, I've seen a lot of autoimmune diseases actually be a result from something going on with the spleen. Okay, so organ dysfunction can actually cause a lot of chronic pain, and nutritional deficiencies can actually be a result and cause a lot of chronic pain, and it kind of goes all hand in hand. Now, sugar is the same thing. I want you to replace like the chronic pain with sugar, because sugar actually causes a lot of inflammation in the body. It leads to nutritional deficiency. It's been known to overabundance of sugar actually can cause vitamin and mineral deficiencies. As we talked about, vitamin and mineral deficiencies may be linked to fibromyalgia, and it sure as heck, if you're having nutritional deficiencies, causes organ dysfunction. Your organs can't function properly. Your bones can't function properly. You're going to have breakdown in the bone. You're going to wind up with osteoporosis, and things like that. So having a good balanced diet and getting rid of the sugar is the key to really overall health, reducing inflammation, and things like that. So how we handle a lot with chronic pain is nutrition response testing. Nutrition response testing is actually a specific technique. I've gotten a lot of patients feeling better. We detox the body. It's very specific. So we use acupressure points to find out what organs are not functioning optimally, the reason why. And as we talked about, is it the heavy metals? Is it the heavy chemicals? Is it food intolerances? What's the reason why your body is not functioning properly? And then we use design clinical nutrition. So we use the same technique to find out exactly what supplements your body specifically needs in order to get rid of the underlying cause and help support the body naturally. Okay. One of the things that was not mentioned in here is emotions. And I wanted to bring that up right here as well, because I can give you all the supplements in the world, but if you're not handling your emotions properly, if you're not taking care of your emotional aspect, you're not going to get better. How many people who have chronic pain have antidepressants? And when they're having, high anxiety, or they're very, very depressed, their pain is worse. Why do you think that there's antidepressants that actually turn around and help with pain, such as Cymbalta? Okay, Cymbalta is an antidepressant. It helps with anxiety, but it also helps with pain, because a lot of people with chronic pain also have chronic anxiety, chronic depression, and vice versa. You're anxious. What are you doing? Your shoulders are up. You tighten up your muscles. You're clenching your teeth. You get headaches. You get stiff neck. You have all these stiffnesses, and which can lead to a lot of other things too. Okay. So, and you clench everything because you're so stressed out, and you tighten up your muscles. Guess what? Those muscles wind up pulling on the joints, and it pulls on the spine, and it actually can cause misalignment too. So this is where, like, actually incorporating mind, body, spirit, okay, nutrition, seeing a chiropractor, and I'm going to let them talk about that in just a few minutes. But this is where incorporating, a lot of different things, making sure that you're nutritionally balanced, to really help with pain management, because this is a multifaceted, you know, um, thing that a lot of people have going. So if you want more information, to help with your pain, help with anxiety, help with depression. So I actually rent space from Body and Brain Yoga. So Body and Brain Yoga is wonderful. They help with a lot of meditation. They help with gentle stretching. They help with relieving some of the anxiety and the depression. And then I use natural herbs as well to help. And I work with people that are on medication too. So there's a lot of people that can get relief from pain, from anxiety, from depression, because it all kind of goes hand in hand. So if you would like more information, I encourage you to visit my website, or give me a call. You can also email me. Here's my email address down here. So, you know, I actually also see people. So if you're not from the area, so I'm in Orland Park. If you're not from the area, I actually do virtual visits too. So I see people far away. I've seen, I have a couple clients, several far away. I'm able to help out wherever you're at. You don't have to be in the area. Of course, I like to visit my patients and have my patients come in and see me. But of course, if you're not in the area, would love to see you and see what I can do to help you out. And right now I want to kind of have, her name is Karen. She's from Platinum Chiropractic, and I'm going to introduce her to you guys. So we're going to switch.
I don't like that. Okay. So as Tracy said, my name is Karen. I'm the office manager at Platinum Chiropractic in Palos Heights, Illinois. My husband, Rory Morello, is the doctor here. He is a general healthcare chiropractor and also specializes in sports chiropractic. He treats athletes of all ages, all capabilities. We even have, well, we've got everybody from T-ball up to pro athletes coming into the office. And there seems to be a lot of misconception about what chiropractic can do for you. As it relates to pain, chronic pain is one of the most underestimated healthcare problems in the world today. Tracy talked a little bit about the effects that it can have on the body. There's almost a circle that goes with it. Pain affects energy levels. Coping with pain drains energy. Lack of energy makes it hard to be active. So activity, pain plus the lack of activity, actually makes it harder to be active at all. Lack of exercise worsens the pain, which rolls into mood. Chronic pain and the limits it puts on your life can lead to depression, anger, anxiety, a whole multitude of emotions. These feelings make it harder to cope with the pain, and it affects sleep. Pain and anxiety make it hard to sleep. Lack of sleep makes pain worse and lowers energy. So it's kind of a vicious cycle of all of it. And like Tracy had mentioned, you have chronic pain and acute pain. Our office can help with both. Dr. Rory is very familiar with a multitude of conditions that lead to pain, and he has quite a bit in his arsenal to help out with that. Let's start out with chiropractic care as a type of treatment that focuses on the body's musculoskeletal system. The system is made of nerves, joints, and the spine. Obviously, muscles in there too, therefore musculoskeletal. A chiropractor uses manipulation to adjust tension or pain in certain areas. It's done as a natural and non-invasive alternative to medications and surgery. Chiropractic isn't just for sudden injuries, for acute injuries, acute pain, it can also help with chronic pain like arthritis and fibromyalgia. Chiropractic care helps reduce inflammation that causes pain. Regular care can also help prevent flare-ups. And when you're dealing with chronic conditions, it's kind of a key thing. Some chiros use adjustments to relieve pain. Others incorporate additional modalities such as ultrasound, cold laser therapy, and electrical stimulation. Massage therapy is an amazing complement to chiropractic care. Chiropractic care also utilizes physical therapy techniques. Retraining the body's natural movement can help release painful muscles. So in addition, exercise can help prevent future injuries by strengthening the musculoskeletal system and how the body actually moves and works. So I guess, overall, if you're looking for a natural way to help you with your acute or chronic pain management, definitely consider chiropractic care. There's so much we can do for you at Platinum Chiropractic. Not only do we have the amazing doctor, we have 4 massage therapists that work with us as well, and they're incredible. Each one has a phenomenal set of tools in their arsenal, and each one has a slightly different technique. So there is definitely somebody that would fit for you and for your needs. One of the other things that Dr. Rory incorporates as needed is acupuncture. He's a certified acupuncturist, and he's used it for a multitude of conditions, everything from PTSD and stress management associated with that to chronic pain issues, rheumatoid arthritis, psoriatic arthritis. He's used it for acute pain injuries, shoulder injuries, knee injuries. Chiropractic isn't just limited to the spine like many people think. It can help with headaches. Gosh, I don't know. There are so many things it can help with. It's very difficult to say what it doesn't really help with. We use it as our primary mode of care for our family and incorporate other holistic as well. I am drawing a blank at this point because, that's the way I roll.
So I would like to thank everybody for coming and watching this video. Again, just to recap. So toxins, heavy metals, parasites, emotions, and misalignment of spine, your neck, these all can actually play a part in chronic pain. There are ways to relieve it. If you would like more information, then please do not hesitate to reach out to me with the Oasis for Natural Healing. You can learn about body and brain yoga as well. Or I'm going to
I can put a link in the comments.
Yeah, we can put a link in the comments, but just in case. Oh, wait, that's going to show up backwards. Okay, so never mind. That was a good idea. So Platinum Chiropractic. So their phone number is 708-361-8800. Their address is 7207 West College Drive in Palos Heights, Illinois. Okay, and I'll put their address and their information also in the comment section on Facebook. This is also going to be on live on Instagram and on YouTube. Okay. All right. Thanks everyone for watching this video. Again, if you have any questions, don't hesitate to reach out. Have a good one. Thanks.